My name is Nicole Harris. I am the functional dietitian at Dr. Vivian Asamoah's office. I am a board certified dietitian. I got my training at Bastyr University. I have about 9 years experience in nutrition healthcare, and I'm also certified in integrated and functional nutrition from the Functional Nutrition Academy, which is a sister program to IFM, or Integrative and Functional Medicine. I, again, am super excited to be here. So a little bit more about me, so you see me as a person. I am a mom, a first-time mom. My son just turned 9 months yesterday. My favorite holiday is Halloween. So every year I go all out making our costumes, as you can see here. This past year I was a piñata. My son was pan dulce, or Mexican sweetbread, and my partner was salsa picante, and I made everybody's costumes. So that's a little bit about me, and I'd like to introduce Dr. Vivian Asamoah as well. So Dr. Vivian Asamoah is a board-certified gastroenterologist, and she has training at Johns Hopkins University, or hospital, excuse me. She is certified with the Integrative or Institute of Functional Medicine, which is the top institute for functional medicine training. She has over a decade of experience in practice as a gastroenterologist in the Houston area, and has led several international speaking engagements on topics ranging from IBS to SIBO, or small intestinal bacteria overgrowth, gut microbiome and how to improve that, food sensitivities, and so much more. If you guys have not found us through our private Facebook group, please join that. We are doing lots of amazing stuff this year, and that private Facebook group is called Natural Gut Relief. So Dr. Vivian Asamoah, please take it away.
I think everyone can see the slides now. This is my crazy family. I have two. I have one at home and one at work, and they're all crazy. So these are my kids, Hannah and Eli, and then this is my work family that I absolutely love. And I spend a lot of time with both of them, and they are both crazy. And I realize that it probably comes from me. I probably make them all both a little crazy. So that's a little bit about me, Nicole. Thank you for that great introduction. So our practice is a very different kind of gastro practice. We are located in Katy, Texas. We serve a lot Houston, and right now we're seeing patients across the globe, from the United Kingdom to Germany to Middle East. And what we do a little bit differently is we help people who feel like they're not getting relief from a GI standpoint. We work with a lot of people with chronic GI disorders who have gone through conventional testing, conventional treatment, and are looking for a more natural, holistic approach to gut health and gut relief. And most importantly, establishing a great relationship with food. I think that's what we see a lot in our practice. So our focus is really on helping our patients get well and not just focusing on illness. So a really more preventative approach to health. So this masterclass is going to be amazing. Nicole and I learned a lot while doing our research. We really dug into the literature and kind of seeing what is available now, when we know that a lot of people are using home remedies, and we kind of wanted to see what's working, what's not working, what's in the literature, what works. So by the end of this class, you all are going to be experts in understanding what is truly constipation, the types of constipation, the health impacts, right? And then the root cause. We decided to put this masterclass together because we have a patient who actually said, well, Dr. Asamoah, why do I have constipation? Like, what's my root cause? And in trying to define that, we're like, okay, let's figure out the different causes of constipation. We want to talk about modifiable lifestyle factors and nutrition factors that can influence bowel movements. And sometimes it's as simple as drinking water for some, and then it's a very easy solution that they never knew about. And then sometimes it's more complex. We want to talk about the conventional treatments that are available, because sometimes they are necessary, and then the natural and integrative approaches. And then I have some interesting novel approaches, new treatments coming out, and some very interesting strategies coming out for constipation. So some new research. So constipation, we'll go back one slide. What does it mean? That little bubble balloon looks really uncomfortable, but I think that's how a lot of people feel. It's a very uncomfortable relationship, an unsatisfactory relationship with the toilet. You know, like you're straining, it's difficult, you're not going often. All of those things define constipation. So the big question a lot of people will have is like, well, do I have to go every day? Like, I've just been going once a week since I was 12. That's normal. And the answer is no. Because if you eat every day and your body eliminates every day, then you should be having a bowel movement at least every day or every other day. So ideally, daily is gold. Daily bowel movement is gold. Kids sometimes will go 3 times a day. Children will have a meal and go right away. They'll eat and they eat, empty out. That's the best way to do it, actually, because that means there's a lot of flow going through. Everything is passing well. So I generally say a minimum of 3 times a week, but ideally every day. So if you're going 3 or less times a week or you've noticed a change in your bowel habits, like you're like, well, I used to have really formed stool, a nice lump before, and now it's like tiny little pebbles. That's constipation, even if you're going every day. And then if you go and you notice you don't have that feeling of, oh, I feel great after this bowel movement. I just feel wonderful. I've evacuated completely. That's also constipation. And if you're sitting on the toilet seat for an hour and you're straining to release like a little pebble or a little slithering, that's also constipation, even if it's happening every day. So those are some of the descriptions. Some people will also say, you know what, I kind of have to put my finger down there and kind of push things around, shift things for things to evacuate and move out. That's also another form of constipation. We'll talk about that a little bit more. So, you may still be wondering, am I really constipated? I kind of go 3 times a day and I feel sort of evacuated and I take my Miralax every day. So I'm good. Well, you're constipated because you're using Miralax, right? So this definition is really for anyone who's using something, Miralax, magnesium, triphala, Chinese herbs to go. You are still, constipation is still an issue, but you're handling it. You got it. So that's important. But if you're still confused, on our next slide, we'll show 2 scores that we like to use. One is the Bristol stool chart, and the other is a chronic constipation calculator that we actually sent in emails. So with the chronic constipation calculator that all of you guys should have received, you can actually check off like, what's my frequency? How much time do I spend? And it gives you a score and it says, yes, you have mild, moderate, or severe constipation. And then the Bristol stool chart, we use a lot in practice because, it's more visual and people are able to say, I think I'm more of like a type 1 or a type 3. The type 4 is great. The type 4 is actually ideal, right? And then we'll notice some people go back and forth where they're like, well, what comes out first is really hard. And then after it's all liquid stool. And that's usually overflow constipation, right? So the description really helps us out a lot. So the recipe for stool formation. How is stool formed? Well, we need water. We need the biomass. We actually need the food contents, the broken down pieces, the breakdown products of stool. We need flow, so motility has to work. And we need a healthy microbiota to actually feed, ferment, and help with motility as well. So these 3 things are really important in the recipe for stool formation. A lot of people signed up for this masterclass, and a lot of people in practice want to bring up the topic of constipation when they see a gastroenterologist. And this is what we do. We really love talking about stool, but it's a really important topic that affects the majority of us. It affects a huge percentage of the American population, about 15 to 30%. Sadly, it affects women more often, right? And we think there's probably a hormonal component there. And it also affects the elderly more often. And I think that's probably because as we mature, I don't like the word elderly, as we mature, we drink less water, we eat less, we're on more meds, and medications can also offset constipation. So when it comes to constipation, you don't go for a couple of days, no big deal. But we notice that it starts resulting in bloating and abdominal pain that leads to other tests. Like, let's get a colonoscopy, let's get a CT scan, because we're trying to figure out what's going on. Nausea, vomiting, people feel tired, just this drained, brain fog, anxiety, headaches. All of these are actually symptoms of constipation where people can suffer from this every single day because they're not pooping. Going to the ER because you're having abdominal pain, needing a disimpaction because there's a hard ball of stool that needs to be pulled out. It's painful, but it's also embarrassing. So getting constipation under control is really, really important. It's expensive. Expensive, why? Because you miss days off work, but also you're trying a whole bunch of different things over the counter, not really sure what's going to work, right? So you spend a lot of money doing a lot of supplementation that may not work. So it affects your quality of life. So it's a really important topic to bring up in practice day to day. Why do we need to even poop? I mean, it would be great if we could just eat and not have to poop, not have to eliminate anything, the process in itself. But, the human being was created to blend into the ecosystem, and all animals poop. And the reason is because we have to detoxify our system. Everything we ingest is not necessarily good. Even certain foods, breakdown products have to come out because we can't break it. We don't need all of it. We can't break all of it down. We don't need some of the nutrients, the undigested food matter we don't need. We can't eliminate metabolites of toxins, metabolites of drugs. Cleaning out the system to balance out the microbiome and reduce inflammation is the reason the body needs to detoxify. And we detoxify through 3 pathways, right? The liver is involved in detoxification processes, the kidneys are involved, and the gut has a huge role in detoxification. So pooping on a regular basis is extremely important. And that's why when we can't clean out and detoxify, we feel so sick. 2 major forms of constipation. The one I'm going to focus on tonight is primary constipation. Secondary constipation is equally as important, and sometimes the two can overlap. So secondary constipation means like you've had adhesions from endometriosis, scar tissue. The flow through that river is not going to be smooth. You've got strictures, maybe from Crohn's disease or surgery. So again, going to impede mechanical obstruction, right? The big one is medications that cause constipation, like opiates, right? Tylenol 3, codeine, Percocet, oxycodone for back pain. All of that's going to result in constipation. Anticholinergics that a lot of people use to control their urinary incontinence or urinary frequency, that is a big cause. And then other things that will impact the flow of the gut. So metabolic issues like diabetes, hormonal issues like thyroid, female hormonal issues like imbalance in our female hormones, that all can affect the bowel movements. We see a lot of patients who suffer from autoimmune diseases like scleroderma, which affects the tightness of the skin, and Ehlers-Danlos syndrome, which affects the elasticity of the tissues, also suffer from constipation. But what we see most commonly is the primary type. IBS-C, which is IBS constipation, chronic idiopathic constipation, which is what we also call a sluggish colon, a sleepy colon, just slow to move, and then pelvic floor outlet syndrome, which is a form of constipation where the pelvic floor just does not sink in terms of contraction and relaxation with the anal sphincter. So although your pelvic floor is contracting to push and release stool out at the very end portion of the rectum, the anal sphincter does not relax and everything just kind of stays spasm there. And sometimes we'll see that pelvic floor outlet syndrome overlap with chronic idiopathic and IBS. And someone who has pelvic outlet syndrome will often say, I feel the stools in my rectum. It's soft, but I'm straining so hard to get soft stool out. And this actually requires a totally different treatment than just fiber or prescription medication. So in primary constipation, like IBS-C and chronic idiopathic, it's the nerve endings, right? Something is affecting the neuromuscular ends. So in conventional medicine, after doing a bunch of research, what do they say is really the root cause, like the causes of constipation? Well, what do they say? And I'll present this on my next slide. What affects that neuromuscular area? They say it's complex and multifactorial, like a lot of things in medicine. They just make it really hard for us to get it. But they say, it has something to do with visceral hypersensitivity. That's just how your colon feels and senses. Or you have colonic neuropathy, just how you have like diabetes neuropathy, where your colon has a neuropathy. It doesn't respond to stimuli, or it takes a lot of stimuli for it to respond. And then they say it could be affected by bile acid metabolism. This one will come up again because bile acid actually cleans the gut up and washes things out, right? They say it could be related to humoral regulation, so how the hormones affect your gut, immune dysfunction, and then your gut microbiota. So they actually list out, from conventional medicine, when you look at the research, the different root causes of constipation. Finally, the last one being alterations in the epithelial barrier, which is just leaky gut as we know it. But generally, when you see a gastroenterologist or your primary care doctor, we don't really think of it this way. We don't think about, what's happening with the bile acids, what's happening with hormones, what's happening with immune. We usually just say fiber, water, Miralax, fiber, water, Miralax, more Miralax. And we hope we get some resolution. From a functional medicine perspective, I think we actually look into those causes in a lot more detail and are trying to really identify the patient's root cause. We don't always find it, or sometimes we find several different things. So we look at the microbiota, and that's where we like actually assessing Does this person have SIBO, bacterial overgrowth? Do we need a breath test? Are they eating enough fiber? What's their nutrition like? Let's analyze their stool. Let's see what kind of microbiome lives there. We assess their immune function through a lot of comprehensive stool testing. We talk about lifestyle stress, which can affect the gut-brain axis. We look at gut permeability. Is there leaky gut? Is there food sensitivity? If so, why? Are they drinking alcohol, taking medications like ibuprofen and things that can affect the lining of the gut? Is there an issue with secretion? The pancreas and the small bowel, are they working well? And then what's happening with the flow? Is the motility okay? And you can't see it, but under the slide, the motility is really affected by electrolytes like potassium and magnesium. And we ask about, how is that stimulating the neuromuscular function? So from a functional medicine standpoint, when we talk about root cause, this is our focus. So methanogenic overgrowth is really important. This is where we're talking about the dysbiosis and imbalance in the ecosystem. We've actually done studies that show that when patients harbor a type of bacteria called Methanobrevibacter or Methanobrevibacter, these are bacteria that ferment food and release methane. But in releasing methane, the methane actually accumulates in the GI tract and actually has been shown to directly slow down the colonic transit, right? So the methane changes how the neurotransmitters work in the gut. So it's by reducing the neurotransmitters and the effect. So when we identify methanogenic overgrowth, it actually can be a cause of constipation and can actually make constipation worse. So it's a revolving cycle. So most of the time, I would say about 80 to 90% of the time, when we do a breath test, a SIBO test, or we do a stool test, and we identify these methanogens, Nicole, most of the time the patient is constipated. We're like, oh, they've got bad constipation, they've got methanogenic. It's a vicious cycle, and we have to actually focus and treat this first. So we've talked about definition, understanding the types. We've talked about the health impacts and the potential root causes. Huge part of this presentation today is about modifiable lifestyle factors and nutrition factors that influence constipation. So I'm going to turn the wheels back to the expert, Nicole, our functional dietitian, and she's going to take us through her research and the information that she'd like to share.
Thank you so much. I did want to kind of take you guys through a relaxation technique, and we'll talk about the benefits of relaxation techniques, I think, as we go through the presentation. But we know that gut-brain connection is very integrated to one another. And so relaxation techniques are really important to have in your everyday life, especially if you struggle with gut issues, constipation or otherwise. And so one of the things that I love to do, because it's free and all we have to do is do it, is breath work. And my favorite breath work is the 4-7-8 breath work or breath cycle. This cycle has quite a significant amount of research in it showing that it decreases stress and anxiety. And we know stress and anxiety typically go hand in hand with IBS, right? IBS-C, IBS-D, all of them. And so the theory behind this, or how this works, is basically that you will breathe in for 4 counts, you will hold for 7 counts, and then you will slowly, controllingly release for 8 counts, right? And the trick is to be able to take in a deep enough breath in that 4 counts so you can hold and release in that 13 seconds. The thing that I think is important to take away from this is that it really only works if you use it and you practice it. And you can't really use it and practice it when you're in the heightened state of stress or anxiety. And so you have to use it when you're feeling kind of okay. So I hope you guys take that away and maybe utilize that more than you have. I know many of our people in our community are very familiar with breath work. They may not have utilized it very much, but they kind of know of it. And so if it's worth kind of investigating and seeing if it can support you in your constipation relief efforts. Mm-hmm. So I want to take you through a case study. Meet Melissa. Melissa is a 42-year-old female. She has thyroid issues. She has vitamin D deficiency, and she suffers with chronic constipation. Melissa eats a fairly standard American diet, as you can see on this page. Starbucks for breakfast, sandwiches for lunch, ice cream for dinner or dessert, and Chick-fil-A, everybody's favorite, quote unquote, healthy fast food. Standard American diet, unfortunately, called the SAD diet for a reason. While this stuff is fun, while these foods can be used or integrated into a healthy diet on occasion, having them on a daily basis is not something that's supportive of regular healthy bowel movements or microbiome. So what's the deal with fiber anyways? To give you a definition of what fiber is plant-based foods that pass through the digestive system without being broken down. We do not have the ability to break them down, but our gut bugs do. Daily recommendations are actually fairly modest. Men ages 50 and under, 38 grams. Women somewhere around maybe 25 grams. As we get older, they generally say we can decrease. Don't believe them. These are the recommendations, a little bit less than what were initially stated. However, as we get older, as Dr. Asamoah mentioned, we're eating less, our colon gets more sluggish. I actually think we could probably use a bit more fiber as we get older, right? So historically, about 90% of adults are not getting in enough fiber in their daily diet. They're not meeting even the minimum recommendations. Standard USDA recommendations are 4 to 6 servings of fruits and vegetables. Functional medicine world, we actually encourage people more 8 to 10 servings of fruits and vegetables, just to give you guys an example. So let's talk about the different types of fiber, because I think it's important to understand them. The best thing about whole foods is that you almost never will get a whole food that just has one fiber in there, right? Most whole foods have a combination of soluble, like you see here, which dissolves in water. Foods that are included in here are oats, apples, avocados, peas. Benefits of this soluble fiber, pros and cons. Let's weigh these guys out. We know that specifically soluble fiber can help reduce fat absorption, can lower our cholesterol and our blood sugar, right? It can increase healthy gut bacteria because it feeds that healthy gut bacteria. The negative part of fiber, if we're not introducing them to our body in a proper way, we can have excessive bloating, sometimes abdominal cramping, maybe some flatulence, sometimes diarrhea, and even mineral deficiencies, because fiber actually is a sequestrant, right? It grabs onto things like cholesterol and glucose and kind of excretes it out of our body. And so if we're over consuming, which believe it or not is a such thing, right? There is a such thing as too much of a good thing. It can actually start sequestering some of the healthy minerals in our body and then depleting our stores of them. The other fiber that we find in whole foods, again, usually both together, soluble and insoluble in fruits and vegetables, is the insoluble fiber. This fiber doesn't really dissolve in water. And really what it does is it helps us speed up transit time of our food. Right? So this is the fiber that really helps with constipation. So it improves the waste removal. It improves our bowel health, meaning as that fiber moves through our bowels, it's scraping the lining of it in a positive way. Scraping is probably not the best word, but it cleans things out. So it's getting rid of the gunk that doesn't need to be there. It's used to prevent and treat constipation. It helps prevent things like hemorrhoids and diverticulitis. And again, a lot of the cons or the things that can go wrong or not feel well if we're over consuming them or increasing them too quickly in our diet are the same as with the soluble. So bloating, abdominal pain. Too much of this fiber as well can actually cause constipation. So if we have a client, Dr. Asamoah and I, who have severe constipation, our first line of action is not to give them more fiber to help with the constipation, right? We have to get the bowels moving and then support continued flow with the fiber. As a dietitian, I am going to say that it is always more helpful to get your nutrients from food. Your body just responds more synergistically with food. However, meeting everybody where they're at, and sometimes it's just not possible to get in enough fiber for some people. And so having some good resources for some healthy fiber supplements that you know can work is super important to have in your arsenal bag of self-care. And so these are some of our favorites that we have and that we've used with some of our clients. I just want to make a note on the sun fiber here. I like sun fiber a lot because it typically, for most people, does not cause the excessive gas and bloating. I have had some clients complain of that about sun fiber, but usually it doesn't. It's typically tolerated very well. So looking for recipes and things or resources to help bump up your fiber. These are two fairly recent books. I don't know if any of you guys are familiar with them, but it is definitely a great place to start if you're wanting some resources to help increase fiber recipes or fiber in your daily diet and repertoire of meals. So in addition to fiber doesn't work if you're not drinking enough water. Probably somewhere around majority of the United States, somewhere between 75% of Americans are dehydrated, like chronically dehydrated. And when you think about that, 60% of our body is water. We are chronically dehydrated. It's just not going to help support the fiber that we may be getting in our diet because we've been really focusing on that. And it's definitely not going to support any fiber supplementation if we're not using or drinking enough water. So the goal is, as you may be well aware, 8-ounce glasses per day at least. Even better, you want to get half of your body weight in ounces. So if you are somebody who is 120 pounds, you want 60 ounces of fluid at least. I wanted to pass these on to you guys because I feel like they're helpful. Ever since COVID happened, I feel like a lot of my clients really struggle with getting in enough fluids. Could be habit formation from always having to wear the mask. I work with a lot of teachers and doctors and physicians who had to wear the mask a lot, and then they're super busy, so you can't just always get away to drink in enough water. And then there's the factor that water kind of gets boring sometimes, right? So these are some ways to get in some additional water intake, right? So we're looking at herbal teas and bone broth, soups and therapeutic smoothies. If you need like different flavors, there's some combinations here. My favorite is probably the watermelon, cucumber, and mint. I always add herbs to my waters because I feel like it just adds a little extra something to it. My second part to all of that is really to get it in where you can fit it in. If you know that during your day is not really going to be effective at drinking a lot of water, then make it a point to have a goal. I'm going to drink this much water when I get up in the morning. I'm going to have this much water on my way to work. When I get home, I'm going to make sure that I have this much water before I go to bed with this much time between it so I'm not up all night peeing. So that's my advice to getting in more water. It can be a challenge, especially if you notoriously just struggle with getting in fluids. So we talked about fiber. We talked about water. Now let's talk a little bit about fat. I think fat has a negative feel in our society in general, but in reality, fat is actually quite literally a lubricant to the gut. So one of the things that I've seen with individuals who are on extremely low fat diets is constipation. And the moment we do something like omega-3s or we focus on just bumping up the fat intake a little bit in the diet in general, they almost always see some improvement in bowel functions. The biggest point that I think I want to mention here about fat is that because of the fear around saturated fats and increasing cholesterol, if you are on natural gut relief, I totally went on a whole rant about cholesterol and carbohydrates a couple weeks ago, so please listen to that talk. But it's a combination. It's what we need is a combination of animal saturated fats as well as plant saturated fats. So yes, you're looking at salmon and chicken thighs and egg yolks, but you also want olive oil and flaxseed oil and coconut and chia seeds as well. It's the combination of the two that's important and not one heavier than the other. So fermented foods. I also did a talk a while ago about making your own fermented foods. But fermented foods are really near and dear and special to my heart. What they do is they really promote good, healthy bacteria. And as you have good, healthy bacteria in your gut, it actually creates nice, good secretions and helps things flow and all of that stuff that we need to prevent constipation. So yes, we'll talk about some supplemental probiotics that are beneficial. But really, again, in food, there's something that just synergistically works better. Wanted to pass along some resources if you guys are interested in making your own fermented foods. Of course, you don't have to. I know sometimes time is money and money's time and nobody got time for that. I have time for that. I actually find it very fascinating to make fermented foods. And if you do too, these are two great resources. So Cultures for Health has pretty much any fermented food kit. You can kind of get started and have like a baseline and have some structure to making your own fermented foods. And then Super Gut is a fairly recent book by Dr. William Davis, who also did Wheat Belly. And he has some great fermented recipes in the back of his book using some awesome and fairly inexpensive culture starters. So keep calm and have a poo. So I'll take a deep breath for that one and talk a little bit more about that stress reduction. So as we started into the lifestyle factors component of our talk today, we did some breath work and we talked a little bit about stress reduction and that gut-brain axis. So stress, anxiety definitely contribute to IBS, constipation, or really just kind of changes in your environment. Travel. Most people travel and they come back and they have some sort of issue with their gut, whether it may be constipation most often, or other things, right? Some acid reflux, just some slow motility altogether. And you may have been eating well on vacation, but it's just the stress of travel and the stress of not being in your own bed and all of those things that can affect the nerve endings in your gut and kind of wreak havoc there for a little bit. The ones listed here are not the only ways to reduce stress. They're some of my favorite: meditation, breath work, sound therapy, nature therapy, mindset work. There are mindset coaches you can work with that really help you just kind of manage things like anxiety and help you see things from a different perspective. So that way you're not living in the future, which is anxiety, or living in the past, which is depression, right? So these things I think are areas that you can explore. I think sound therapy right now is a place where I'm playing around a lot. Top 5 apps to help you reduce stress. Again, there are a million apps out there. These are some of my favorite. Nerva is actually really nice. It's actually a gut hypnotherapy app. I think you get free 7 days to try it, but it really goes into explaining gut-brain connection and the impact of it. And a lot of my clients that I've encouraged to do this have all come back with raving reviews of the Nerva app. Insight Timer is more of a meditation app. Calm is also meditation. Aura has a combination of all of them. And then Breathe is more of just guided breath work. Let's talk about sleep. Nobody really talks about sleep and its relationship to constipation. But really, people who are struggling with getting sufficient amount of sleep at a 38% increase risk of suffering from constipation. Now, there are several reasons as to why lack of sleep could be playing a role, right? Oftentimes when we are awake or forcing ourselves to stay awake, we tend to snack on things that are maybe not the healthiest things just to try to stay awake, right? That 3:00 cookie just to get rid of or get through the rest of our day type of thing. And it could be really kind of the hormonal effect that happens in our body when we are sleep deprived that can be wreaking havoc on our gut bacteria, and our gut bacteria kind of supports in that type of environment of whatever gut bacteria is there, right? And if it's conducive to like methanogenic bacteria, which lack of sleep can kind of promote, then we are creating an environment that just slows everything down. So the important thing is to take inventory of your sleep hygiene. What does your nighttime routine look like, right? Are we avoiding stimulants? Are we decreasing tension and anxiety around bedtime? Are we paying attention to light and noise and temperature of our bedroom? If your room is too hot and you're waking up in night sweats 30 minutes after sleep, maybe we need to pay attention to the temperature of our room. Other things, think about your bedding and your pillows. How long have you had that bed? How long have you had that pillow? Is it completely flat because you had it since high school? Have you had the same bed for 20 years? Maybe we need to buy a new one. And then I listed some natural supplements here. I would only say use natural supplements when you've really tried everything else, right? When you've used kind of gut hypnosis or meditation to fall asleep and you've tried some of these other things listed here, then natural supplements like melatonin and 5-HTP and taurine and even magnesium can support relaxation and get you into that nighttime routine, reminding your body that, hey, it's now time to rest and relax. Activity is a huge component that can also support healthy bowel movements. Reality, your colon responds to activity, and good muscle tone in general is important for regular bowel movements. So the abdominal walls and muscles and the diaphragm and all of these different components of your abdomen play a big role in how effectively your bowels are moving. So it doesn't mean that you have to go out and lift weights like Arnold Schwarzenegger. It just means that you have to be moving and lubricating your joints. And so I listed some more low impact things that you can think of, or that I could think of, that would be helpful just to improve bowel function. So yoga and Pilates, these are things that actually really kind of crunch the abdominal wall. And things like Ashtanga yoga have positions specifically geared towards, putting your elbow at your abdomen to help support movement and help release different types of muscles and things like that. And Qigong and Tai Chi have a component of meditation in them, as well as stretching and exercise and movement. And then walking and hiking and strength training. The minimum effective dose of activity is actually 10 minutes. And so if you are one who is finding it hard to find time for activity, start there. Again, get it in where you can fit it in. Wear ankle weights while you're walking around at work. Take the stairs, right? Do little things, and they always add up. So top 5 nutritional supplements, and I'll be going over these in detail in a second. But we want to talk about magnesium, vitamin C, probiotics, aloe vera, and triphala. So magnesium, many of you have probably been privy to magnesium. There are a lot of different types of magnesium out there. We have magnesium malate, carboxylate, oxalate, oxide, citrate, blah, 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 all of them. And not all of them are created equal when it comes to supporting constipation. So the 2 that I like the most and have used the most for my clients are magnesium citrate and magnesium oxide. It's important that you talk with your physicians before starting any type of supplement. I just want to say that firsthand, because not all supplements are appropriate for each individual, right? You have to take into consideration where your health is at right now, what conditions you may have, and so on and so forth. So for instance, taking too much magnesium oxide can lead to a condition called hypermagnesium, whatever that word says, because it's not coming out of my mouth right now. But basically what this is a condition caused by too much magnesium in the system. This typically happens with individuals who have kidney dysfunction, but sometimes we have dysfunction and we may not be aware of it. So I gave you here some daily recommendations. So citrate is also important to note that it can cause some cramping and gassiness. Oxide typically does not cause that. So either one of these are a good option to start out with. I tend to like magnesium oxide a little bit more, and they tend to work better in divided doses throughout the day instead of one specific amount. What I have learned is that most people are not taking an effective dosage of magnesium to support resolve of constipation. Vitamin C is also another good option, which many people do not know can support healthy bowel movements. We often use, when we're using vitamin C to support bowel movements, we do what is called a vitamin C flush. When you're choosing a vitamin C, again, not all vitamin C is equal, right? So emergency, if you're taking a bunch of emergencies, probably not going to cause a whole bunch of bowel movement, right? So it's important that you choose a vitamin C that has essential buffering minerals. So these include things like calcium, magnesium, potassium, zinc to support the vitamin C and facilitating bowel movements. The dosage of vitamin C that is important is anywhere from 1.5 to 2 grams to facilitate healthy bowel movements. We talked about fermented foods, which is a component of probiotics. If you are wishing to use an actual probiotic supplement, many of them can work fairly well, but there are specific strains that you may want to look for inside the probiotic. So Lactobacillus plantarum and Bifidobacterium lactis are 2 strains that have actual research behind them in supporting resolve of constipation. Aloe vera and triphala are 2 other supplements that we've used before to support constipation, and you can see the dosage recommendations there. Aloe vera can be used in several different forms. Here I just have the capsule dosage, but you can also use aloe vera in liquid and gel form. And no, not the gel form that you would put on your skin for sunburns, just saying. So don't go out and buy that and ingest that, okay? So again, if you've tried many of these things that we've mentioned here and you're sitting here saying that I still have constipation and none of this stuff is working, you need to dig a little bit deeper. So going back to what Dr. Asamoah mentioned earlier on in our talk, we need to understand the root cause. Do we have food sensitivities or intestinal permeability issues? Do you have low stomach acid or hypochlorhydria? Do you have small intestinal bacterial overgrowth or small intestinal fungal overgrowth? Are there parasites? Are there hormonal imbalances? These are things that we need to investigate with a healthcare provider who is familiar with these things and who's not going to sit there and say you're crazy or avoid hearing you out, maybe running some out of the box type of testing. So now I'll relate it back over to Dr. Asamoah to talk about some of the big red flags that you really need to be aware of when you're looking at gut health and chronic constipation.
Thank you, Nicole. That was an amazing, very informative presentation, very thorough. I actually learned a lot and will add a few tips for my patients as well. So when it comes to constipation, chronic constipation, we understand has been going on for a long time, and most people are trying to get resolution. We worry about our patients who have had a sudden change in bowel movement and are now blocked up, right? Or patients who are experiencing rectal bleeding, weight loss, or abdominal pain. This is the kind of situation where you want to see a gastroenterologist or a primary care provider and get scheduled for further testing, either a CAT scan or a colonoscopy, to make sure that there's nothing that's causing an obstruction and causing the change in bowel habits. So this is something we really wanted to highlight. When it comes to medications, this is after everything's been tried. We've tried all of the recommendations that Nicole mentioned in terms of nutrition and lifestyle, in terms of monitoring stress and improving sleep habits, exercising. But sometimes, I'll be very honest, and we practice a very integrative approach at our practice. We really try and focus on everything that's modifiable by the patient. It's sometimes not enough, and we have to introduce prescription drugs that are relatively safe and that can help. So I'm going to just list them out because it's not really the focus of today's talk. But when it comes to prescription medications, you've got osmotic laxatives like Miralax, which I don't like at all. I mean, it is truly a, what do you call it? They say it's, what's Miralax again, Nicole? It's carb freeze stuff. That's basically what it is. Yes. So long-term use is not great. Most of it is not absorbed in the system at all. So it's fine, but long-term use is not great. All it does is pull water into the colon. A lot of people will experience some loose, lumpy stools, but not really a sense of evacuation. Magnesium, of course, as we discussed, is a natural supplement that can be used a lot in Europe. Lactulose. So these are osmotic laxatives that just basically pull water into the colon and then release. Stimulant. So this is something that's actually helping improve the motility, triggering the nerve endings. So you've got senna, cascara, castor oil, sodium picosulfate. Of course, everything that is triggering the bowels and stimulating the nerve endings will cause a lot more cramping and abdominal discomfort. So be careful with that. Secretory laxatives are what we have now. They are medications that you'll often find at your gastroenterologist may give you samples of Amitiza, Linzess, Trulance, which is plecanatide, that basically will cause the water channels in the colon to open up and release more water and therefore cause more flow and bowel movements. Again, sometimes causing abdominal pain and cramping and sometimes causing the opposite effect of diarrhea. So there isn't really that balance, We want formed stools. We don't want liquid stools every day because you're losing too much fluid. And then we have medications that work on the 5-HT4 receptors. So receptor agonists, the serotonin receptor agonists like tegaseride and prucalopride. The brand name for prucalopride is Motegrity. A great one that actually just kind of stimulates the motility, not firing on the nerve endings, but just encourages the serotonin receptors to turn on and helps with just peristaltic flow. And then and that's actually one of my favorites. I think both tegaseride and Motegrity work best for a lot of our patients. Medications, stool softeners, Colace over the counter helps as well. And then, sometimes there could be a little bit of hard stool in our patients who in the rectal area, in our patients who have this pelvic floor dyssynergia or outlet obstruction that we discussed, where there is a dyssynchrony between the pelvic floor muscles and the anal sphincter. And so stool gets stuck in the rectal or in little cavities in the rectum called rectal seals. And taking something by mouth often doesn't help. A little gentle suppository of glycerin, vesicodil, or gentle enema or CO2 releasing suppositories can help in these situations. Now, a lot of people ask about coffee enemas and transanal irrigation. Transanal irrigation is the medical term for colonics. And so it was really interesting to find that colonics are actually recommended in many parts of Europe to treat constipation. When you have tried many other things and it's failed, the colonic is used to stimulate the nerve endings of the colon and allow things to flush out. So a lot of people will notice that when they get a colonic, there's that initial flush from the colonic itself, but then a couple of days later, they start noticing they're having bowel movements, right? But it's not a long-lasting effect. That's the issue. It's not long-lasting. A lot of people don't want to do colonics forever. And colonics can also be dangerous at times, right? We've seen cases of perforation where the colonoscope has actually perforated through the colon. And then where do they go after that? They come to the gastroenterologist. They're in the ER. It's a problem. But it does work well for some people if used safely. Coffee enemas. Coffee is a natural stimulant. And coffee enemas are beneficial. Lukewarm coffee enemas are beneficial for some patients who suffer from constipation and actually have some pretty good detoxification properties too. So as an integrative gastroenterologist, I've looked at the research. I have nothing against coffee enemas. However, I do caution my patients against colonics because the long-term effect and benefit is not there. Okay. And the risk of perforation is significant. We talked about pelvic floor dysfunction, guys. I was talking about the outlet obstruction with the pelvic floor. And one of the therapies that actually really works well is physical therapy for the pelvic floor. When there's an overlapping syndrome with IBS constipation or that sluggish colon, that chronic constipation. And we have wonderful pelvic floor therapists in Houston and in our Katy area who have actually been able to do phenomenal work helping our patients regain that strength in the pelvic floor and also be able to synchronize relaxing the anal sphincter and contracting the pelvic floor muscles to be able to have a good bowel movement. So that's something that should be in your doctor's toolbox when it comes to investigating root causes and providing you with solutions. Physical therapy, pelvic floor therapy, biofeedback. So I looked at new novel therapies, and guys, thanks for bearing with us. We're near the end of our talk now, but there are two that I wanted to bring up. There's a vibrating capsule for constipation coming out. So it is a capsule that you swallow and it's connected to an app, and you would program the app to turn on the vibrations of the capsule, maybe between 4 a.m. when you're asleep and 6 a.m. So imagine this little capsule is just vibrating throughout your colon and doing what? It's actually stimulating the nerve endings of your colon. And in the morning you wake up and you're like, oh, I need to have a bowel movement. And you just go have a bowel movement. And the success rate, it just came out. The FDA is going through its final trials. The success rate was over 60%. So 60% of patients who used it, who didn't use any other methodology, they weren't necessarily taking fiber or magnesium or anything else, had success, were able to have a bowel movement, whereas they weren't able to have it before. So you would just poop this thing out. It's a disposable capsule, poop it out. The next morning, take your second capsule, turn on your app, program everything, and there you go. So this is artificial intelligence at its best in the world of gastroenterology and finding more solutions for constipation. There's a new medication that is actually being approved in Asia, Southeast Asia, Eloxobixibat. I don't know why this name has to be so complicated. Eloxobixibat. But basically what this drug does is that it allows for more bile acid dumping in the colon. And we know that bile acid in the colon pulls water in the colon and is a natural cathartic. So it causes diarrhea. Now, this is where I have issues with conventional medicine. You know, we're actually stimulating excess bile production, right, to release stools and cause diarrhea to fix a constipation issue rather than looking at root cause. I mean, the whole thing is complex and a little bit crazy, and I just don't know where that's going to go. But when it comes to trying to find solutions and treatments for constipation, you can see that the pharmaceutical industry is doing a lot because it's a huge problem. And, you know, a lot of people are looking for the quick fix. But if you go through and review what Nicole had discussed in terms of lifestyle and nutrition, there's a lot of work that can be done before you get to the solution, a vibrating capsule and the BBB name medication thing that's coming out soon. Oh, so Nicole put together a healthy blue muffin challenge recipe for those of you guys who want to try, who are still not sure after this presentation as to whether you have constipation or not. It's got this, what did you use for your blue? Nicole, is it blueberries? Was that what gives the blue color? Or is it a natural dye?
You actually have to still use the royal blue color.
Oh, you have to use it. It won't stay. Okay. Yeah. So you do need a little bit of a food dye. And so you make these blueberries. I don't think I'm going to try it. Nicole, let me know if you do. What did you use in place of sugar? Stevia?
I actually used maple syrup.
So, okay. So it may be good. And then you're basically observing your stool every day and seeing on what day do you notice that your stools turn blue, right? And if your transit time is greater than 24 hours, you know, you're noticing on day 3, you got constipation, right? So this is a simple challenge that you all can do. It was actually started by a company called Zoe's, and I think it's helpful, right?
Yep. I had to brace myself when I was redoing the recipe because I really wanted to add in like things like sweet potatoes and things like brown rice flour and all of these things that would improve, a transit
Fiber,
time,
right. But
So I
that
had
would
to like back
change
off
the
and like,
results though. Yeah, that
yes,
would change the
yes.
results. It would change the outcomes.
So
Yeah.
I did go for a more natural sugar maple syrup, but I cut it in half.
Okay, cool. We have that constipation calculator, guys, that we shared on the initial email that we sent for resources. So if you still kind of want to see where you fall in the spectrum of constipation, check out the constipation calculator. To see more about our educational resources, Nicole did a wonderful video where she was making fermented sauerkraut. Nicole, where she went through her entire recipe and did an online cooking demo. We've done great talks about fiber, probiotics, and more recently about carbohydrates. So if you're not part of our private Facebook group, there's where we have a Back to Basics live every Thursday. We usually have a guest or one of us is talking on an important topic, and we share great resources, and it's a wonderful community. So join us on Natural Gut Relief to learn more. And we are done. So this was really, we tried to put together a very comprehensive presentation, trying to get to the root cause of constipation. We thought was important as a functional dietitian and gastroenterologist, really talking through it with our patients and trying to figure out where the issues were, providing them with multiple solutions, whether this was pelvic floor therapy, biofeedback, whether this was really just talking about sleep, nutrition, or incorporating magnesium and vitamin C if they'd never tried it. And that's kind of what we do at our integrative functional GI practice. Nicole is a wonderful asset to our group in bringing everything that's high quality, evidence-based, functional dietitian research. And then I try and incorporate really the gastroenterology portion. So if you are someone who's living with chronic GI issues, constipation being one, not finding solutions, trying to get to root cause, I hope that we've shared a few other things in terms of testing that may need to be done, or in terms of nutritional tips and lifestyle tips that you guys may need to address. Reach out to us if you still need additional help. You may be our patient, you may not be our patient. We're happy to just schedule a discovery call with you and see what else is out there that could help. I wanted to share one last thing, Nicole. We didn't talk about my dad's Contracts water. So my dad, y'all know, some of you may be practitioners on here, but although I'm a gastroenterologist, my family members treat me like I know nothing about medicine and health, right? They're like, do you know my sister's friend's daughter said that this medication is the best? Have you heard of it? So my dad has struggled with constipation for a really long time. And I had him on all sorts of soluble and insoluble fibers, banding hemorrhoids and doing all sorts of things and having him work out an hour per day and everything. And he did okay. He was doing okay. And then one day I called him and I said, Dad, how are your bowel movements? He goes, oh, I'm healed. I'm good. I'm like, what happened? He goes, well, my friend told me about this water. And I was like, what water? And he was like, well, there's this water from France. It's this mineral water. It's this water that has mineral trace elements in it. And it has magnesium, potassium. And he goes, I just drink a liter every day and I just go. So I quit all your stuff. And I was like, what? And it really worked. And he just drinks this water that has magnesium, potassium. So just adding a little bit of trace mineral elements, right? Trace minerals to your water could be a simple solution, because trust me, I had him on like 2 servings of Metamucil every day, Benefiber with his coffee. Like I had him on everything. And it was just as simple as finding something that stimulated the neuromuscular endings. And it was magnesium. That's all he needed in water. And that has been his solution. So sometimes the solutions are simple. They don't have to be complicated, and the solutions can be natural and holistic and good for you. So we thank you guys for joining us. We've gone a little bit over time. Nicole, let me give you the floor for the last words.
Yeah, I really did enjoy tonight. And I hope that you guys did too. That's all I have to say. I hope that you spend some time with your family, share the information with your family and friends, and refer anybody over here who you feel can use our support as well. Thank you guys so much.
Have a great evening. If this helped you rethink your gut health, like, subscribe, and share it forward. Follow us on Facebook at Natural Gut Relief for more tips, videos, and live Q&As. Thanks for watching. Your gut will thank you.